The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. I said, no. Flu shots.
Flu shot.
Flu shots. My flu shot professor is here. Good morning, Dr. Mencia. And I have to ask you a question about flu shots.
You got your flu shot. Congratulations.
Absolutely.
I got mine.
I was down there, I got my flu shot, and I was just saying, I didn't even feel anything. And then I forgot about it, completely forgot about it. I got home. The next morning, I noticed a Band-Aid on my arm. I said, well, I had a flu shot. I didn't ever feel anything.
Yes. If you get your flu shot frequently, your immune system will adapt to it. And you will, a lot of patients, they say they will go and get the flu shot, but they don't want to do it anymore because they say the first time I got the flu shot, I got really sick. And we try to explain to people that that's great. If you get really, really sick the first time, that means you have a very robust immune system and you are responding full steam ahead to the flu shot. Now, having said that, after you get follow-up flu shot in the years to come, you will have a tendency of not getting that sick because one flu shot compared to the year before, they are very similar. They overlap with each other. So the body now recognizes the injection and will respond normally. So let's say when we do the hepatitis immunization, we do 2 to 3 injections for the body to start building antibodies so you don't get hepatitis B. So you get the first injection, you will have a little robust response. Some people, I remember with my first hepatitis shot, I never get headache. I got a headache with the first one. But I went for my second injection, it was perfect, no problem. Then I say, maybe the headache was not related to the shot. And my doctor said, no, it's one of the side effects. So yeah, you probably got it from the flu shot.
But I have to
from the hepatitis injection.
But I have to tell you that I just had a friend who just got the flu. They lived up north, and they were telling me 2 weeks knocked them. This is a physician himself, actually. He was a pediatrician, and he had a little bit of an asthmatic condition anyway. He went to 2 weeks. It really, really shook him up. And I say, please, everybody get your flu shot in. There are people who say, I don't get flu shots. I've read that. I have friends say, I never get flu shots. I said, oh, really? Mm-hmm. You've never really had the flu then?
Yeah, one of my patients is in his early 60s, and he's a lawyer. He's in solo practice. And he said, I almost closed my practice. I just couldn't work. He said, I was miserable. I'm by myself. So it was and he had to pay his overhead, his staff and everything. And he said, it really took me down, So he said, next time I pay whatever it is, $20, $40 for a flu shot, and not to lose this much money. And I said, it was foolish of me not to get it.
Well, one thing,
he's a smoker. He has all the risk. So I'm always telling him, make sure you get your flu shot, and he postponed it a little bit.
But one thing is that Dr. Mencia told me, and even though it's very convenient to just go up to the corner Walgreens or CVS, not to get it there. I mean, look, we don't want to put them out of business, but I would never go there.
Well, no, they are not doing it for being in business. They're doing it as a convenience to people, but I will never go there either. I will go to a doctor. Go to your doctor. Sometimes you get a little brochure from either your insurance or your or the pharmacy, especially those chain pharmacy, Walgreens and CVS and those big chain, and they will send you that they will give you the flu shot. But you want to keep your record together. Keep your record. You have one doctor, go to your doctor, get your flu shot from your doctor. And at least you keep that with your record of when did you get your flu shot, when did you get your pneumonia shot. Yes, we are not kids anymore, but sometimes we fall down, break a hip, and you end up in a rehabilitation center for a few weeks or months, and then those records become important, because if they don't know who gave you the pneumonia shot, who gave you the flu shot, who gave you the other immunization, by law, this rehab center, they had to start injecting you again, because it's better to inject if we don't know than to leave it up in the air, say maybe, because there's too many lawsuits going on in rehabilitation and nursing homes, so they're trying to cover themselves. So you will be the guinea pig and you will get all the shots.
Yeah, well, I don't know who gives the shots in the drugstores and where they find people to do this. I'm sure that they're very careful to have someone who's licensed, but that's not where I want to go for my shot. I'm sorry. I mean, we make light of it to get your flu shot. That's because I go to Dr. Mencia. But I'm not going to go to the corner plumber or somebody.
Exactly.
They could have a plumbing company and they bring in a nurse and say, you can have your flu shot. No, I'm not doing that.
Exactly. I agree with you. 100%.
Okay. So we took care of that, right?
We took care of that.
I have to say that I have a friend, and I'm just going to say Jo Lynn, who has listened to Dr. Mencia probably ever since he started here. She's listened to my shows for longer than that. And she adored him, and said, "Oh, I have to go to Dr. Mencia." Well, she doesn't have a car; she lives up in Boynton Beach, and she's a wonderful friend.
Very sweet.
Yeah, very sweet, very wonderful person. And she said, I don't have a doctor, but I only want to see Dr. Mencia." And then she definitely wanted to see a doctor, so we took her down there, and she is so happy. And she said, "Everything you said about Dr. Mencia is true. The place, everybody was so nice, and I think that's what people. It's one thing to have an excellent doctor, but your staff is really important. And boy, they're so friendly and the open. You call it's not a front desk; it's a concierge.
It's a concierge.
I love that.
It's a concierge, medical concierge.
It is, because people are friendly. They care about you when you come in, and I think you're starting to have a library in your lobby. Every single thing you want to read is there, including Boomer Times.
Absolutely, yeah. We run out of Boomer Times, so we had to have more copies of that.
Have you recently been in other medical offices? Do you know how different yours is?
At the beginning, when I first came over to Florida. Growing up in Hawaii, we don't have. I wasn't used to storefront type of medical office. I was not used to that, so I was kind of taken by coming to Florida and seeing so many storefront doctors, and it's like little bodega here and there. So.
Down in Miami, it's really every little place. It's either a coffee house or a bodega or something. It's for medical or sex. Something.
Free massage.
Sorry.
I went down to Miami to. When I first started, I was working in one of the hospitals doing. I initiated for them a primary care clinic for one of the major chain hospital in Florida, and so they invited me to Miami to go into to work with a doctor that he travels a lot, and he wanted, quote unquote, he travels a lot, and he wanted somebody. I think he lost the license or something, and he wanted somebody to cover for him and bring my license over. And when I walk in there, I walk into the waiting room, I look around, I just turn around and draw back. I say, this is what I want to be.
It's a bus station, right?
Yes. So my dream was to create a center that is very homey, open system. I didn't want those glasses and window blocking the staff from the patient. I want open. I want people to come in and feel comfortable. I want the staff to engage with the patient. Because people come to see you not because they are sick. Sometimes they just come for a checkup, and we tend to block everybody and say, okay, we are the staff and you are the patient. You stay on that side.
That's right, Dr. Mencia. Oh my. You've got it.
It's one of my medical representatives that come from one of the pharmaceutical company. Say, Dr. Mencia, I was sitting there the other day waiting for you. I was on deck because there was another rep in front of me. So I was sitting there, and I noticed as soon as you came to the front to take care of the rep, you took care of the rep. There was 4 patients behind the rep lining up to talk to you. So they will come and one will say, oh, when I go inside, I want to talk about this. And when I go inside before you see my husband, I want to tell you something. So one by one, I say, okay. And she say, it was so beautiful. I never seen a medical office that the patient are so free to interact with the staff and the doctor.
That's after you give them a hug and a kiss.
Yes.
Yeah, and the other day, because it had rained, there were 3 bird cages that are usually outside. They were inside. And the birds talk to you. Now, do they examine you?
They whistle. When they see the lady, they whistle to the lady. They go...
No, but they're saying all sorts of things. And so,
they talk a lot, yes.
Yeah, they talk a lot.
I love you.
That's right. They hear a lot of that, and it is true. And it's it is very special.
They are like you, very sex-oriented birds.
I hear them panting. But I was just asking you that because there are some very high-powered physicians who you walk into this sterile office, and of course it is the big windows, and it says, it doesn't even say to knock, it says sit down and we will be right there. And
don't knock on the window.
But we always do because you don't think, but no one knows. Mm-hmm. It's not like a bell rings. It used to be there was even a dinger. Mm-hmm. You could ding and let them know you were there. There's no dinger now. So you just sit and you don't know what. It is horrible, Dr. Mencia. And here's this. They spent a lot of money on a gorgeous office, with all the bells and whistles.
Yes.
And you really don't feel like you're wanted. So you really have, that's the key. Besides being an extraordinary doctor, you have then taken care of the whole way that's why people come to see you so much.
I remember I went with my uncle to see a doctor in Broward, and the lady is behind the window, so he goes, and I'm going to knock on the window. My uncle say, no, see, read the sign, don't knock on the window. So I say, okay. So we stand in there, so they see your shadow, then they open the window. And
wait, they don't open all the way. Sometimes it's halfway. And they give him but the lady, I'm observing, because my field was psychology before studying medicine, so I observe behavior. So I'm observing the lady chewing gum. She doesn't even make eye contact. She handled a paper for him to sign. He signed, please. Give it back to her. She grabbed the paper and she goes, have a seat, but without even looking at my uncle. And she closes the window, and we sat down. Then we went to the room, and we waited in that room almost 45 to 50 minutes for the doctor to come in. And I say, wow, this is horrible. I say, I don't want to practice medicine like this. And you don't?
I say, I don't want my patient to sit in a room for... And, I tell you, sometimes with my consultants, we have problems because the patient, they are spoiled now. They are used to me.
Of course.
And that when they come in, I feel that their time is precious. And whatever they need to do, I make sure, we take care of them and they can go. And, yesterday I had one of my patients, and I was in a meeting, and she was there. She saw one of the consultants, and she wasn't happy. She wanted to see me before anything happened, and she's on pain medication. She wanted to get it from me. And I came down from the meeting, and she goes, oh, but you're supposed to be in a meeting. I said, I am in a meeting. I just came down for you. She was so happy.
That's right. It took 2 minutes just to make sure that you are there.
And she was happy because she knows those prescriptions now came from me, and she, I know her well, and she was happy with that.
I have a doctor. I have a gynecologist I've gone to for 20 years, and he has just now he has a very big specialty, and I won't tell you the hospital that is employing him for 2 days a week. And the first thing that they said, he's used to when you come in, first you go and sit in with him, and then you get undressed, and then he examines you, then you come back and sit in with him. He's a fantastic gynecologist. So now this place says, no, we don't have time. You just see, they undress and you see them. He says, no, I will not work that way. So it's kind of what you're saying, exactly. that he respects the patient.
The patient.
But yeah, because, a woman, she has to get undressed, and the doctor's there, no. After you've known him, it's not a problem. But when you first meet a patient, he doesn't want to do that. He doesn't want to meet you with your clothes off. In a sense, it's the proper way. And that's what you see, that it's really, a patient is more than just the body. And
exactly,
you're saying it's the psychology.
It's the
and once
psychology,
they love you,
the social aspect of the patient.
That's what's going to help them make them feel better and get better.
Absolutely.
And you know that.
I'm being blessed now that the last blessing from, the most recent, I should say, the last is before you die, the most recent blessing from God, we have a visiting professor from Venezuela. His name is Dr. Pedro Gomez Castro, and he's a plastic surgeon. And yesterday we have an event at Mrs. Ruiz that was very nice to organize the event in Weston. And she was saying, even when she goes to the Cleveland Clinic and those major hospitals, sometimes the care is not, even though it's a huge institution, the care is not what people expect.
It's an institution.
It's an institution. That's what I told her. I said, it's an institution. It's a big, big organization, big research, and a lot of students, and
and it has its place.
It has its place, right?
It has its place. But it is different going into your center, especially. Now, there's some doctors, I think you probably should run a company. I've been thinking about this. You probably should run a company on the side. You have no time. But where you train doctors how to have a good office, not just how to be a good physician, how to have a good office. I do this with sensitivity training. I've done this for hospitals, for doctors, for everything. Doctors are interesting. They don't think that there's all that matters, many of them. They think it's just, I'm a good physician, I'm tired, I'm taking the time, I don't care what my nurse says. It's very...
Yeah, I used to tell my administration for the past maybe 10 years or so after we organized what we have now, and it was in the beginning stage. And I was, I usually tell them there's two big companies within this organization. There's the administrative company we have created, and then there's the medical company. And the administrative company should definitely grow out, but you have to have the right people and the right training for the staff. But you're absolutely right. Yeah, there's a big need out there because if you go back, I don't blame the doctor for the way they practice medicine. When you go to medical school, you rotate with doctors. And if they are storefront doctor with a window, when you open your practice, you will do basically the same thing because you see all the doctors are doing just that. And a lot of the students, I teach for Nova University, a lot of the students, when they come and rotate with us, they say, oh my God, this office is so different to any of the other offices I've been to. So they notice the difference on the staffing and all of that. And then now they have a choice of saying, do I want to be that kind of doctor or do I want to practice like this?
And my guest is Dr. Andy Mencia. Of course, you if you've been listening Saturdays, you hear him from 7 to 7:30. He has founded the Adult and Geriatric Medical Center, which is on East Commercial Boulevard, very close to Holy Cross. His phone number, please write this down. This is a number you should put on your refrigerator. In your bathroom, wherever you're going to need this. Someone needs to know this is the doctor to call, and you should go. Make sure you get an appointment. Start with him, and then he'll be there with you forever. Call for your appointment. It's 954-489-1345.
And we open on Saturday.
And he rushes out of here to open on Saturdays. I'm going to ask you about that in a minute. 954-489-1345. And you really ought to go to his website because he has a lot of the talks he's done, and you'll be able to hear them and see him. AdultGeriatrics.com. It's called AdultGeriatrics.com. And before I ask you about the Saturday visits, I have to compliment you about Ina. Ina has she really manages downstairs sometimes.
You're
there and there's a little problem. She runs
Yes.
right out to help.
Yes.
She really does see everything. She's turned out to be, I didn't know what she would have been like, but she really cares a lot, and she's got a wonderful heart, And she really tries to manage things.
She tries really hard.
She really is trying very hard to do this. Anyway, let's talk about Saturday appointments.
You see that the Cora in the waiting room, see all of that?
Yes.
That was all her
very
doing.
beautiful.
Yes.
Yeah, the Halloween. Oh, for Thanksgiving. It's gorgeous. It really is. Let's talk about Saturday appointments. Mm-hmm. Why did you decide? Here you are, a very busy physician. You have a family. Why did you decide to take your time and open on Saturdays?
Because I will see so many patients on Friday because they will be afraid of the weekend. And the weekend, we're talking no long weekend, just Saturday, Sunday. And sometimes it will break my heart on Monday when I come back to work. And I start seeing patients that say, oh, Saturday, I decompensated, went to a walk-in clinic. And they did this to me, and they did that, and I'm so disappointed. Or I went to an emergency room, and I waited for hours and hours just to get an antibiotic. And, it was a waste of my time. I wasted my whole Saturday, or my whole weekend was ruined. So I felt that there was a need for at least one more day in the office. So I sat down with the staff, and I say, let's give it a test run. Let's go ahead and open on Saturday for a few hours, and let's see how the patient will perceive this. Will they see it as something positive or not? And lo and behold, they embrace it so positively that sometimes on Saturday we are busier than any weekday. So Saturday have been a tremendous hit for us. And the other day I was working on a Sunday. I was doing paperwork on a Sunday, and somebody come and knock on the door. One of the patients come and knock on the door and say, I'm running out of my blood pressure medication. So I thought you would be here, so I came to see you. And I say, sure, come in. And I opened the computer and pull out his information, gave him a prescription for the blood pressure. He said, well, are you going to charge me my copay? I say, no, it's okay. Just go and take your prescription, go to the pharmacy.
Yeah, you have built up something that's really amazing. How is the pulmonary organization next door working?
Wonderful.
Tell people about that.
The pulmonary rehab is so crucial for, the lungs are so important for the entire body. It's what I call the inside window to the outside world.
There you go again.
Because, you imagine, you take oxygen, the inside window to the outside world, because it's the only organ that exposes itself to the outside, but it's completely internal. And, when you take air through your nose and your mouth, that air will go into your lung, and the exchange of waste material, like carbon dioxide, for oxygen, is the primary function of the lungs. So persons that have been exposed to asbestos or a smoker, patient with chronic infection of the lung, patient for asthma, patient that for whatever reason had been intubated, let's say a car accident or fall, hip replacement, they had been intubated. Sometimes those lungs are no longer the same. And the patient will go and say, I feel shortness of breath. And if you say it to a cardiologist, you say, it's your heart. And they start doing all kind of things to the heart. And you finish, and then you go back and say, I'm still having shortness of breath. So I say, okay, now let's look at the lungs. And I believe that anybody with shortness of breath, they will see my cardiologist and my pulmonologist simultaneously. And I will not let them do anything invasive until I have both of those reports coming into my hands, so that at the end, what I want to see is that the shortness of breath get better. And a lot of people that have chronic fatigue, it might have been induced by problem with the lung because you are not getting enough oxygen. Patient with fibromyalgia, patient with Alzheimer's disease. Usually the lack of oxygen will worsen the capacity of the memory to function and recall things, so they will categorize you as an Alzheimer's patient. Sometimes they will say you are depressed, and you give them oxygen and they feel better. So that is not depression. Depression doesn't get better with oxygen. So the lung become very, very important to basically each and every organ of your body. So next door, what we're doing with the pulmonary rehabilitation is try to help the patient breathe better. And we do, just like we do in my center, both a traditional and a holistic approach to treatment with acupressure, acupuncture, exercise, but everything is geared toward improving the function of the lung. And where did the idea come from? From one of the patients. He's the husband to a lady that used to work with you. They live here in West Palm Beach.
Know.
You know who they are.
That's how that happened?
He started having shortness of breath. I sent him to a rehab program in West Palm Beach. And he came back, he said, oh my God, Dr. Mencia, this is the best thing that you have ever sent me to. This is amazing. And he started telling me, I started doing research. I didn't know anything about lung rehab. So I started doing research.
And that's why you have that. And is he doing better now? Is he still around? He's around.
Excellently.
Fantastic. Well, that's Dr. Andy Mencia. I have to tell you, we're so happy that he's here every Saturday morning. His phone number is 954-489-1345. That's 954-489-1345. He's going right now to take care of patients on Saturday. Please, if you want the best doctor around, you want to talk to Dr. Mencia. Thank you, Dr. Mencia.
Good to see you, and I'm happy you got your flu shot.
Oh, of course I got my flu shot, and everybody should get their flu shot. It's just the last word about that is forget this thing that say I don't ever want a flu shot. All you need to do,
at least come and talk with me about it. Let's talk about
but just all you have to do is see what a flu really feels like, and you'll get a flu shot. Right?
Absolutely.
It's too dangerous, especially for older adults. Children, older adults, they need to have them. How am I doing?
Excellent.
Okay. It's good for sex, too.
It's good. I knew. Rachel, I don't know what I'm going to do with this woman.
I do this just for you. Okay, our next guest is Dean Webb, who runs all the Faith Farm. I know you have to rush off, Dr. Mencia, but, the people who, Dean Webb, from Executive Director of Faith Farm, is certainly going to be here with us, and you can listen as you're driving.
Okay.
All right. Thank you. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the state.